The Rubin Institute was founded in 2001, and it's a specialized institute that deals with orthopedic problems, both pediatric and adult. And we have a group of orthopedic surgeons in the Rubin Institute that have had specialized training, particularly in complex problems as well as routine orthopedic problems. In addition, the Rubin Institute has a staff of outstanding nurses and physical therapists devoted only to orthopedic problems. In the last 7 years or so, the Rubin Institute has led the state in the number of orthopedic procedures that are done in the hospitals around the state. The experience that the doctors have here is very important. They handle not only routine cases, but they handle complex cases. Surgical intervention is a big decision, and you have to buy into the entire program. You can't just think, oh, I'll have the surgery and I'll be fine. You have to buy into the therapy programs afterwards and sometimes before, and you have to buy into possible complications that could occur. Even though we don't want it to occur, it could. So you have to be prepared and go in with a clear conscience. And you should try to be in the best medical shape that you can be in to undergo this procedure. There are surgical approaches, and these surgeons here do all the approaches and can explain to the patient the pros and cons of various surgical approaches.
Joint replacement, when we think in terms of people that have end-stage arthritis and that have pretty much exhausted all conventional means of kind of avoiding it, and that would be like people that have gone through physical therapy, people that have had cortisone injections, people that have had doing exercise and doing everything that they can to possibly, prevent one, and then also the use of non-steroidal anti-inflammatory medications have been a big boon as far as keeping people from having joint replacements. It gets to a point where eventually the arthritis becomes more severe and none of these are effective anymore. This is something that we're able to offer the patient as far as in terms of, well, we have this available to you as far as, we can do a joint replacement. It's kind of a resurfacing procedure because what we're doing is really taking the end of the bone and replacing it with metal and then with usually a plastic interface so that they have the ability to be able to do the things that they need to do. Arthritis in itself is really not basically a disease as much as it is a condition in where the cartilage just wears away and you have bare bone rubbing on bare bone. With the joint replacement, what we do essentially is we take away all that bone where the cartilage was and replace it, like I said, with a metal. In a hip replacement, what we do is it's a ball and socket joint. We remove the ball, replace it with a metal stem and ball, and then put a cup in where the pelvis would be, and that becomes the interface.
Because this is a major operative procedure, if we're talking about total joint replacement, the patient really has to be in as good a physical shape as they can be. So that means that you will need clearance from your family doctor, meaning that you have been examined and that your heart and lungs are in good condition. We'd like to have all of that done within 7 to 14 days before surgery so that anesthesia and your treating doctor can look over the various test results to see if there's anything that needs to be looked at again.
We have most of our patients evaluated also by a rehab physician while they're here in the hospital. They make the assessment that if they're able to do they set benchmarks as far as if you can walk so many feet without too much assistance, or they make an assessment based on what the physical therapist finds. If they're doing very well, then usually they go home with just the basic exercises and the family care. If someone is like older, more debilitated, then they'll make a recommendation as far as like, well, you may benefit by having inpatient rehab, be it at our hospital or a lot of times because of their insurance, they're sent to outside facilities that they can do their rehab, and that's what they're getting, the physical therapy every day and getting the exercises that they need to do.
Recovery from a major joint procedure is not just recovering in the hospital. The patient has to put in effort as well as the therapist and the doctor. And another thing that we have here at the Rubin is the specialized nursing group while you're in the hospital. They make rounds virtually every hour, tending to your needs, making sure you can do certain things that will enable you to go home and function on your own.
With hip replacements, we usually give them a limited physical therapy regimen. They're usually using some kind of assistive device for the first 5 weeks. At 5 weeks, we have them come back at an x-ray, we see how they're doing, and then we start them on a regimented, really intense physical therapy program to recondition their muscles, basically, to strengthen what we call the abductors for the hip replacement.
We have treated patients at the Rubin from all 50 states, 5 continents, and 50 countries. I've had both of my hips replaced here in the last 18 months, and I'm feeling great. I'm able to walk without pain, I'm able to cross my legs, and I'm even able to golf. The care is excellent. The physicians are well trained. This is a special group of people who have done everything they're doing on a repetitive basis, and in addition, they're very compassionate and enthusiastic about it.